we are going to have a discussion led by our partners from the National Harm Reduction Coalition, Tanagra, Melgarejo. Please let me say that, make sure that I said that right. But Tanagra, I am going to turn it over to you and look forward to the wonderful discussion with the panelists.
Hi, everyone. I am so excited to be here with you all this morning. And I heard some names of folks that I know. And so I'm excited to be in community with those that I know and to like hopefully meet some of you that I haven't met before. As Duran said, I work for the National Harm Reduction Coalition, and I've been invited to support with this morning's panel discussion, which is thinking about what's working and where change needs to happen in terms of how we provide and offer harm reduction services. And I really think that the poll was enlightening, right? Because there's things that we do that we know makes it easy, and there's things that are challenging. And I'm hoping that with the help of Sam and Angie, we can explore that those in depth, and hopefully this conversation can help us figure out how to take this back into our programs and continue to dive deeper into how can we make the most accessible harm reduction services possible to our participants. So I am going to ask our friends Sam and Angie to introduce themselves. Sam, would you be could you please share with folks who you are and a little bit about yourself that you want folks to know?
Sure. Hi, my name is Sam Junge. The hat I'm wearing today is I use he, him, and his as my pronouns. The hat I'm wearing today, I volunteer with Harm Reduction Service, a program in Portland, Oregon called Portland People's Outreach Project, which is actually a kind of umbrellaed under the People's Harm Reduction Alliance, or PRA, which is a Washington-based harm reduction nonprofit. And I'm really excited, and I identify as an inactive drug user. It's been several years since I accessed certain service programs, but I've been a methadone patient, and you know, I don't identify as being in recovery. So I've had the opportunity to be on both ends of the certain services and harm reduction program kind of dynamic.
Thank you so much, Sam. I'm excited. And one question that I want you to think about before we finish, so hopefully you can share with us, if you had to be in a karaoke contest, what would be your karaoke winning song? So give it a think. So before we finish, we can share those, and I can share mine too, because I'm excited to share it. So it's nice to meet you finally this way. Angie, I would love to have you introduce yourself.
I'm Angie. I believe in harm reduction. When I was in Portland, we did not have harm reduction. And I saw the AIDS quilt. And only a small portion of it fit in the Portland Coliseum. So whether I am in active use or in recovery or just not using because I'm broke or don't want to or whatever, it doesn't matter to me. I believe in harm reduction. And so when Sabrina gave me this opportunity to be part of this panel, of course I jumped on it, of course, because those are real people in the streets, in the gutters, in the houses. They're real people who die when we don't have harm reduction. So that's why I'm here. Do I have to sing if I tell you my karaoke song? Because I don't want to sing.
You don't have to sing if you don't want to.
Good.
And if you want to sing
Good.
at the end and you decide you want to do that, absolutely, we can have we can close out by singing, the three of us. So we'll see. We'll see how we feel afterwards. So yes, so we'll get back to that. We'll get back to our songs before we close out the conversation. But I wanted to ask you both one first question, which is if you can share with us. Oh, hi. Oh, awesome. We have Tommy's here. Yes, we're so excited that Tommy's joining us. Hi, Tommy.
Tanagra, can I just take 1 second? And if people are not speaking, please put yourself on mute because there's a lot of background noise. So if you'll mute yourselves until you're ready to speak, that will be great. Thank you.
Yes, thank you, Greg. I also wanted to check in and see if Tommy is oh, hi Tommy, how are you? Good morning. Would you like to introduce yourself to folks? You're on mute, so I think maybe I can unmute you. We are navigating some, yes, we're navigating some tech here. Hi,
There you
Tommy.
go, Tommy.
Hey, how you doing?
Good, how are you?
I'm fine. Thank you for asking.
We're excited to have you here.
All right, all right.
So we just started, and I was just posting our colleagues and friends in the panel that are joining you, Angie and Samuel, our first question, which is if you could share about your previous experience, either accessing or participating in harm reduction services. And I'm going to ask Angie to respond to that question first, if that's okay. Angie, would you like to take it up?
Okay, so say that again. My screen was doing weird things. I didn't quite hear it all.
I just wanted to, if you could share with us about your previous experience being a harm reduction services participant.
All right. I was just actually talking to my barista / daughter this morning. In Hayward, California, I was explaining to her that any place where there was a free meal or any harm reduction services of any sort, if you were to gander around the block, you would see police officers just hanging out, waiting to figure out who they're going to arrest. That's not a good thing. In my opinion, that discourages people rather than encourages them. But being that I have a daughter, that makes me a mother. So on the flip side, I don't believe in the legalized shooting galleries that are coming along, because unless we only give that service to people who have track marks, right? Why encourage something that can be so painful as addiction? But I love HEPAC. I don't know if I'm allowed to be a cheerleader or not. I love HEPAC. They do everything from feed me when I'm hungry to keep me safe when I have a sore thumb or a stubbed toe, and never once have I ever felt judged. I know many of the people that work there are in a sober living life right now, and still they have found it in their hearts to serve people who are not so sober without any obvious judgments. If they're judging me, I don't know about it. So I think they bring meals, medical care, and harm reduction at every level, right down to making me wear a seatbelt if I go in a car with one of them, and that is also harm reduction. So the attitude in which the service comes is key, I think, also. Those are my good experience. But the discouraging fear that you might be arrested if you leave the building is not a good thing. And that's what I would say I would change from my experiences, like I said, from Hayward area and Castro Valley area. Those, not trying to be picking on Hayward, but that's what happened.
Yeah, no, thank you for sharing. So it seems that thinking about harm reduction, accessing harm reduction services and previous experiences, right? Having to navigate police presence, right? Or having police be around, the space where services are provided can present a barrier for folks because it doesn't necessarily make us feel safe, at least until we enter the space. So I really appreciate you sharing your previous experiences trying to access those services. I would love to also hear from Sam. If you can share with us about what has your previous experience accessing harm reduction services look like?
Yeah, in Portland, Oregon, the Multnomah County Health Department, the local health department, operates harm reduction services that they've expanded a bit since I was accessing them, but accessed their syringe exchanges and at different sites. I was fortunate enough to live pretty close to one. I had different experiences depending on who was there. I think more often than not, unfortunately, I got the impression that there was this asymmetry in the relationship of like, we're the cool provider, we have access to the like tools and the stuff, and we're like benevolent enough to give it to you. And it just like, there were a lot of times where I didn't feel like it wasn't that I didn't feel welcome, but I didn't feel like I was a really valuable part of the experience, and I felt like I should just get my stuff and go. So it became a much more like, okay, I'm here to meet a like very material specific need, and not like there were so many opportunities. Like if somebody had like their body language and the way they engaged had been really welcoming and caring, it could have, just had a big impact. And it was those times when the folks working had like a kindness and an empathy that like I had my best experiences. I think that the limitations, it was a 1-for-1 program. And so unfortunately, I wound up in a situation at various points where I would have a drawer in my room at the time where people would throw their used needles when they came over and they injected. And when I was dope sick, was in withdrawal, I would, didn't have needles, I just reach in and grab one. And so I think there's also, I think, a lack of a lot of engagement opportunities in education. I think sometimes what happens at syringe exchanges and harm reduction is that there's so many basic concepts that like people that are working in the field are immersed in, they forget not everybody knows about them, and not everyone is educated, and that not everyone remembers. And so like, there was a lot of things that I could have learned about, for instance, hepatitis C. I was fortunate enough to clear it, but I could have avoided getting exposed. And so I think there's like the like policies, the bad practices of 1-for-1 and, limiting other supplies. And then there's like the more abstracted, like, how is your, what is the dynamic when somebody walks in the door? Do they feel loved? Do they feel like a client?
Yeah, thank you, Samuel. I would love to ask Tommy a question, which is sort of Sam and Andy have like led us into this sort of part of the conversation, which is what attracted you to harm reduction services? What made you feel safe and okay and comfortable accessing those services?
It's, it keeps you from getting any kind of diseases. The stuff they give you, like the Narcan and everything else. I've saved one of my homeboys' lives with that. So, he OD'd and fortunately it was there. I had it, and I saved his life. And that was great. So, I'm myself. I don't do heroin. Methamphetamine. That's what I like. That's what I do. And that's what I'll continuously do.
Yeah.
But it was good that they handed me the Narcan to save my homeboy's life. Otherwise he would have been dead.
Absolutely. So I really appreciate you sharing that, Tommy, sharing with us that experience, because I think when I hear you share, what it was like to be able to save your friend's life, right? It's like harm reduction services allow us to come in and be fully who we are, right? And listen to us, meet us where we are, and also give us tools, right? Tools that we can use to keep ourselves and our community safe. And that example of you being able to be there for your friend and have naloxone available, even if your drug of choice is not necessarily a drug that it's connected to naloxone in terms of reversing an overdose, like to be able to do that for someone else is really powerful. And I'm really grateful that you were there to be able to do that. Thank you for sharing that really powerful experience with us. I also would love to hear from Angie and Samuel if what drew you to harm reduction services? Like what attracted you and made you feel comfortable accessing the services?
For me, in the beginning, way back in the 80s, I used to get paid money to drive from Portland, Oregon to the border of California, clean syringes, because they were not available in California. It's still regulated considerably more here than in Oregon. But what took me to needle exchange, honestly, where I go now, is I was homeless, and then I was housed in Oakland.
think maybe, hi, Andy. I think we're having a hard time. I think maybe Angie's having some connectivity.
And if you go here, help you, they have doctors. And when I went there, they didn't just have doctors, they had dinner and everything. And it was kind of scary for me because Oakland's way bigger than Hayward even, which is where I came from to Oakland. It seems bigger to me anyway. But I grew to love it, and now I live right down the street from the office, and like I went there yesterday or the day before on Tuesday. I went there just to say hi to Sabrina. I didn't even need anything. But I still have all the things. I don't know. What drew me there was some medical care. Asthma inhaler, that's what it was. I needed an asthma inhaler. But that's what drew me there. I didn't have a doctor. And I'm grateful, because they bring everything. They're like the 4-ring, 5-ring circus all in one little motion, And they're like Tommy said, they've given me Narcan, which I've given to a handful of people. The last person I gave him Narcan, he said, "Oh, last night I woke up with some random person massaging my chest. I would have died. Luckily, someone else was there that knew what they were doing." He said.
Thank you for sharing that, Angie. So it seems from what I heard you share, like what drew you was a very concrete need, right? Like a concrete need that what you needed to be met, but also what kept you I think with Tommy's example too, what keeps bringing you back is the sense of community, right? The sense of camaraderie and support as well, to be part of something.
Yep.
Thank you.
Sam, yeah, it is. And I will.
No, go ahead.
I will volunteer there if they will have me. I just can't seem to get my shit together enough to fill out the application.
But you always know the opportunities there, right?
That's right. And anytime if they need me to dump the trash or anything, I always am like, what can I do for you? If I'm walking by even, because they are that important in our community. I really believe that, because there could be a mess everywhere without the services they provide here, at least in Oakland.
Well,
I believe.
And I also think you being here and sharing your experience is a way also of contributing to the program, right? Like you're an spokesperson to the program, for the program. So that's also, I see also a contribution there as well. Sam, I wanted to give you a chance to share, what drew you, what attracted you to harm reduction, what made you feel safe and okay, feeling good accessing the services?
Well, I think kind of what Angie was referencing, like necessity. Like I needed needles, and the pharmacy, like I didn't have the money. Like I was running out of money, and so the necessity. I think, fortunately enough, like in Portland and the time period that I was using, like there is in our climate, there's enough acceptance. Like it's not so taboo that like in some places, more rural areas where folks are very suspicious or concerned about safety or arrest. I'm fortunate enough that type of stuff didn't really enter my mind because I talked to so many other people that accessed it. I think word of mouth like gets around, and reputation, it's really important. So I think there's always this like juxtaposition of the like material needs, like I need to have needles, cookers, cottons, like those things. And it was always such a great feeling leaving with a bunch of fresh gear. But then like there's the other element which references is like community psychosocial support, like and then like the education and the other things that kind of like on the public health side. But I think it can't get lost to harm reduction providers. Like these people are meeting a very important material need, and like you have to operate on their level. You can't prioritize like testing or disease prevention education or overdose prevention if you're not getting them in the door and making them feel safe and comfortable and like validated. And I think it's like there's so many opportunities to make people feel safe and welcome, and then that gets around town. And then also like related to necessity is accessibility. It's like if it hadn't have been that I lived 4 blocks in Exchange, probably wouldn't have made it because I didn't have my shit together enough to like track time and make it when I needed to. And I think that's a deficit of the service. I think like inherently because of drug prohibition, like people that are using like drugs regularly or daily, it's really, really hard to track and plan and survive. And so it's like, I think there's this notion of like, if you want this stuff, come to us, and it should be the other way around.
Yeah. Thank you for sharing that, Sam. And I think going in that direction, like I wanted to explore with you all, when you have experienced barriers, right? Accessing services, when you have experienced services being inaccessible to you or hard to access, like what do you think are some of the reasons? What are some of the barriers? Like what are the barriers that you think are there that make it hard for folks accessing those services? And I think, for example, you sharing the experience of like, you know, for example, if you didn't live nearby a harm reduction service program, like getting there, like the times of the day that it's open, sometimes it's the space in which the harm reduction services are held inside of, like, you know, an institution or a building that make it inaccessible. But I want to sort of think more about, when you think of barriers, what are other barriers that you have experienced or heard other folks experience in terms of accessing these services?
I mean, yeah, making services accessible. Like I think at all possible moments, the provider needs to take the onus off people who use drugs to be able to get the service. I think, like I heard it from one of the staff's mouths later on in my life, like, oh, they know when our exchange is. If they want it, they can come get it. And it's like, you know, again, if drug prohibition is as terrible as we know it is, like people have a hard time. And like, are we doing this to prevent disease and like address public health imperatives, or are we doing it because we care about the people like on an individual and community level? And so I think the barriers of like, you need to be open when people need you to be open. You need to be in places where people are going to be able to find you. You need to make people feel safe. You need to advertise. You need to message. You need to, and most of all, listen to the people that you're serving. Like, and I think that the poll about, you know, how easy it is, it's like, it shouldn't be hard if you just have to put effort. You have to make it a priority, like whether it's an advisory board or, you know, some type of voting system, or just like repeatedly prioritizing with staff and volunteers. Like, you need to be asking people about their experiences and what they need and what they want. And maybe they just want to get their gear and go, which is fine, but you need to make sure that space is available for people to safely share.
Thank you, Sam. Angie or Tommy, do you have any thoughts around what are some of the barriers that you think you have either experienced or heard others experience in terms of accessing services?
I'm right around the corner. You know what I mean? I'm like,
yeah.
I'm walking distance. Like, I'm like, just like maybe 100, 200 feet away from it. You know what I mean?
Yeah.
And I mean, as far as I know, and the people, I mean, I know people that drive to, you know, to go there a lot. I mean, it's good that you have it because it's, you know what I mean? It's not only keeping a lot of disease out of the community, I mean, because, you know what I mean? But it's like, I mean, it's good, you know what I mean? I mean, I don't know what else to say about it, but I'm thinking that, you know what I mean, we owe you guys, and you know what I mean, a great gratitude for you know, coming out and doing that for us.
Yeah.
You know what I mean?
How do you feel welcome into the space? Like, how do you know, when you showed up, how do you feel involved? Like, you know, how do you get it? Like, how do you feel comfortable being involved? Because you're there, you were asked to show up today and share your experience with us. And I think there's a piece of harm reduction services that is the way that people get treated, right? The way that we show up for people.
Oh, yeah. I mean, you guys have never been nothing but courteous. You know what I mean?
Yeah.
As far as my experience.
Yeah.
You know what I mean? You've been courteous and you know what I mean?
Mm-hmm.
And you know what I mean? I appreciate it. You know what I mean? Especially, you know.
Yeah.
I don't know what else to.
No, I appreciate you. I think that piece of being treated like a human being, being treated with respect and dignity, that is part of harm reduction, is so important, right? Because we know when we're not. And that's when we choose not to engage with people or with services, right? Because it doesn't feel comfortable and safe. And so from what I've heard Sam and you share, and I would love to hear from Angie in a second, is that one piece that is really important about harm reduction services is really not only creating the space, but creating a space where people feel that they have ownership and participation, and that they're engaged, and that they're asked to share their expertise and knowledge, right? That participants can contribute to build the services and build the space, right? And contribute ideas, and also able to share when things are not working, so that we can make them work for folks, right? So I think that active participation, that active expertise, that active engagement is so important. Angie, I would love to hear from you, if you have thoughts about this.
Well, I gotta say that, yeah, I gotta say that the number one key thing that stands up to me from HEPAC is that I don't feel like an addict. I feel like a human when I deal with them. If that makes any difference in your mind, any understanding of that, I don't know how to explain other than that. For example, one of my friends passed away about a year or so ago, and again, Sabrina, who works at HEPAC, we were gonna carpool to the service, and she said, "If you need money to buy a card or flowers, I will give you some money for that." Now, I remember going home and thinking, man, if I dealt with somebody on the level she deals with me, I would think they could just give up that fix and buy the flowers or the card. But she didn't come like that. She came like, whatever your challenges are, I will help you to overcome them, because I know this is an important thing to you. That's how you treat a person rather than an addict. The other great thing is that she's not afraid to be human herself. She said, I have to put all these packs together for the exchange on Wednesday night. You want to come to the office and do a packing party? I messed it up because I thought it was a packing of Christmas gifts for volunteers, because it was during December. But we sat together as a group and we stuffed them all. So now I became a part of my community in a way I never thought I would be, you know. And also, they're mobile here. I've been here 3 years now, so I don't know that they've changed or not changed in Hayward or Portland. When I was in Portland, you could just walk in any store and buy them, but you would be judged. You would be judged hardcore. And many stores, like, I don't even know if Hiram's is in business. Hiram's one time told me, no, I could not have clean syringes because I wasn't diabetic. And I told him I would one day maybe love someone that he already loved, and then I refused to buy them from him, right? When he changed his mind. You could get no services in the 80s there without huge amounts of ridicule. Here, not only can you get the services, but they'll come to me and give them to me if I need them to, you know? So there's a lot in the form of doing a job versus doing a passion. I think that I see a difference here in Oakland compared to other places I've been. That makes it easier to participate in, because a lot of people are afraid. I get syringes today for people that won't come to, I don't use them because they're afraid of this, what is the right word? The label that'll be placed on them if they're seen by anybody else, not us, but anybody else in the community going to the no needle exchange. They don't want that label on them. So I'll do it because I'll do it any day of the week for anybody, know them or not.
Thank you, Angie. I appreciate you sharing that. And I think highlighting, you know, or uplifting something that I heard you say that I also think it's connected to what Tommy and Sam were sharing, which is, you know, that harm reduction services are crucial and vital because they provide a space for people to be themselves in their full humanity, right? And also provide a space for the community to see folks that use drugs not as behaviors, as their behavior, but as full human beings, right? And as full human beings that can contribute actively and very much so to their community at large, right? Like harm reduction services are integral to the community because we are part of the community, right? And so I think that it's such a beautiful, it's such a beautiful way of naming for me what harm reduction services has done for myself and for my community, right? So I really appreciate you sharing that. I wanted to ask you all a question, which has to do with, if you were put in charge of setting up a harm reduction program, what would be the things that you would like that program to have? How would you like that program to be in the community? Like if you could have your say, like what would be the things that you would include in that program to make sure that we are also making it accessible to folks that use drugs?
I would, okay, number one, I would, there's a million things I would do. I would try as much as possible to have it operate via both stationary and outreach, go to where people are, but then the stationary site is imperative because you need to have on-site services and to have as much as possible in one place, to not send people here for screening, here for Hep C treatment, here for MAT. MAT on-site is a must. I think, and medical care. And I think having outpatient IND services is imperative on site. I think that's a huge lack, is like when people don't have anywhere to go to get their abscesses treated other than the emergency room, assuming they don't have a primary care provider. So I think like an outpatient IND on site. I think the supplies would be a big thing. I would make sure people can take as many syringes as they need. I would have as many sizes, types of needles. I think that's too often not prioritized. Is like people need, like a lot of people have different preferences for sizes and different needs. And then smoker supplies is a must. Having as much as you can under one roof, but also knowing that there's barriers for people to be able to get there. And then a safe consumption space on site. I mean, I think the real question is, what wouldn't we put there?
Well, I wanna hear from Angie and Tommy too, but I wanna ask you also if you wanna share, what would be the thing that you would tell folks, like what would you not do? Like what would be the things that you would avoid to make sure that we are working from the spirit of harm reduction? Like based on your experience, what you've seen, you'd be like, okay, these are things that I know I want to avoid because I know that they don't work.
It's like excessively immersive messaging. So I think what happens is folks are surrounded by, don't share needles, get tested, all of the kind of repeated messaging that like it doesn't get, it loses its kind of value and its significance for folks. I think not having a one-for-one policy, trying as much as possible to empower participants while they're there, to not feel like clients, to feel like participants. So like to whatever extent is hygienically possible, letting them act like physically get the supplies on their own. So like not having a like provider client relationship, and not having folks that working or volunteering that don't love drug users and aren't like 100% committed to making the process about participants. And then I absolutely would make sure not to be push recovery on people. That's like, you should provide what your participants want, but if you try to push recovery on people, you're irrelevant to them.
Thank you. Angie, I would love to hear from you. What would be the things that you would have in your program and the things that you would consider avoiding doing?
That's a hard one for me, because I agree with everything that Samuel just said. Really, I do. And I once understood, I had a case manager who told me that they could not encourage me. They couldn't even suggest the idea of me going to recovery program They said, you're smart, you're intelligent, you know what it's like to be clean, you know what it's like to be in the street, you know what it's like to be everywhere in the middle. And I am not even able to suggest the idea of recovery to you. And I said, why? Maybe me or someone like me just needs a little bit of a push. And apparently statistics show that if you give that little push, the person will probably fail. Whereas if they 100% come upon their own idea to go and get clean, that they will succeed. Much better chance of them succeeding. And I did not know that, though I thought I knew everything. I really want to co-sign with him on that, not to push recovery. I can't really, honestly, I can think of nothing I would do different at all. I would hire 4 more Sabrinas. That's what I would do. 4 more Sabrinas that would make it perfect. And that's because we love Sabrina. Yay, Sabrina. She's great. You know, if I didn't know her on the level that I know her, which is probably not near as much as some people, I would never believe she was anything but an angel. You know, I would never believe she had ever used, or I would never believe, maybe I shouldn't be telling her business. She's a great person, and she's non-judgmental, and she's caring, and I would hire 4 more Sabrinas at least. That's the one thing I'd add.
Oh, Andy, I think we lost you for a second.
To jail, came out of jail needing supplies and had none to give back. You know what I mean? And they say, we'll give you a new kit. 10 max. What if I'm really using 10 times a day? I need 70. HEPAC just, I say, I don't have some. They say, how many do you want? 20, 30, 40? You know, sometimes if I get too many at home, I take the used ones so that they can get the credit for their funding. You know what I mean?
Mm-hmm.
I mean the unused ones rather, because I know that it's something to do with that. So I believe, you know, I would maybe add a car wash for donations or something. They do it all right in my book. I can't think of anything to add.
No, I appreciate you sharing that.
And I mean that. I'm not tooting horns. I really mean that.
I think you bring, Sam, and both of you bring up a really important, several important points, but one thing that I want to uplift is the importance of having the right folks working at harm reduction programs. And I think what makes harm reduction programs successful is to have either folks with lived experience that are able to be there and practicing from a place of harm reduction, right? And really embodying those principles, and folks that really want to work and do this work, right? Because they believe in people, right? Because they believe in the power that people have to make their own choices, and the power that they have to inform our programs to be the best programs that they can be. So that importance of having folks really truly embody and believe the principles of harm reduction is super important. And I think the other piece that I think I heard you also say is like programs that are rooted in best practices, right? And we know that best practices tell us, you know, that we need to center the expertise and the voices of people that use drugs, right? That we need to create spaces where there's the least amount of barriers possible for people to access the services, right? So examples such as having multiple sites and different avenues for engagement, and also needs-based, right? That we want to make sure that we're offering folks the supplies that they need in the amounts that they need them to be well, and to promote secondary or peer-to-peer distribution, right? So all those things are things that you've all had mentioned, right? That are, I think, really important for programs to keep in mind, right? I also wonder, you know, I have one question, and then I want to ask folks from the audience if you have questions for folks to share them in the chat box. But I think, you know, I think harm reduction programs, I wish that I had a magic wand and I was able to show folks that are in opposition to harm reduction programs why harm reduction programs are so important and so valuable in our community, right? So if you had to face someone who is in opposition to the program, for example, someone who is opposition to HEPAC, or someone who is opposition to your program up in Portland, what would you say to those folks? How would you, what would you say to them to try to get them to listen to you and see the importance and the beauty of harm reduction programs? What would be your message to them?
Are you asking everybody or the?
All of you. All of you, if you have an idea, we would love
My answer. The one thing I would tell people who don't understand harm reduction is the same thing I told that pharmacist in Hiram's many years gone by. One day, somebody you love could fall in love with someone who is currently using. Maybe they get clean and they're the best in-law you could ever have, but they have HIV or Hep C or some other horrible condition that they don't even know about. Who knows? Keeping one person in our community, no matter how we as individuals might judge them as individuals, keeping that every one person as a single person safe keeps the group safe. If you let one person in your community fall in the gutter, that person could pull your whole community into the gutter with them. You know? And I believe that because I guess because I'm a country girl, I've seen people fall off boats. I don't know, but I believe that.
Thank you, Angie.
I think a big kind of broad message is, and principle is moving from the like traditional concept of harm reduction or the public health side of like, okay, people are you going to use drugs? We can't prevent it from happening, so we might as well reduce the bad things that result. To like, I think it's a problematic term, but I use it anyway because it's convenient. But I think of it as reducing the harms of prohibition, because I think it's impossible to isolate the supposed consequences of drug use as like inherent to the use itself. And it's too often all of the things that prohibition and lack of safe supply do means that we conflate all of those things with the effects of drugs themselves. And so I think having a mindset of like, your job is not to reduce the bad things these people are doing. Your job is to understand that people are trying to pursue health and wellness in however they know how. And they like, you need to accept and affirm the idea of the body as a site of pleasure. And that if you don't do that, then you're inherently going to be like playing catch up in the sense of like, you're trying to prevent like the worst things from happening. You're gonna be trying to put a Band-Aid on things when you should really be trying to promote general health and well-being and flourishing without, and the key is without constituting what those mean to your participants. Each person can have a different, like what health and well-being means to them is different. So your job is to offset the harms of prohibition by like exploring a mutual relationship and a horizontal relationship. Like, it's not you educating people by telling them what to do, it's you mutually educating each other and like having a collaborative approach and like making sure that people who use drugs are, in addition to being recipients of services, they're the designers and the people who implement those services and the people who provide them too. And so you can't get to a place where you can promote health and happiness if you're looking at it as you need to do this thing to these people and not I need to learn from you and we need to do this together.
That totally makes sense to me, Sam. And I want to ask a follow-up question. It's like, why is that so difficult? Why is that so challenging? It's totally common sense. My father used to say in Spanish, el sentido común es el más común de los sentidos. Common sense is the most common of senses, right? It's like something that makes total sense. And yet there's so much resistance and like, there's so much, like we struggle so much to get people to see that. And I want to ask you why you think that is.
I mean, I don't have the answer. I know part of it is a bigger cultural and social puritanistic mentality and like the I don't remember the quote, but it's like I think it was H.L. Mencken said something to the effect of like, somebody somewhere might be experiencing pleasure. And I don't know why what produces the like puritanistic, like, you know, pleasure is inherently harmful. I think, you know, religion may have something to do with it. But I think that, you know, that accounts for it, because there's this glaring contradiction, which is like, you know, we believe in freedom and people, the ability for people to pursue life, liberty, happiness, but like, we don't want to let people put, you know, have freedom to control what they put in their own bodies. So I think, I'm not really sure where it originates, but you know, I think there's a kind of domination mindset of like controlling other people's bodies is inherent to our like cultural
on what we've been thinking about in terms of why is it so hard for people to recognize that we have the right to decide over our own bodies and our decisions in terms of what we do with them and experiencing pleasure. Why do you think, because harm reduction programs see that, right? They understand that. Why do you think it's so hard for people outside of those programs to really embrace or consider that possibility of allowing us, people that use drugs, the ability to decide over ourselves? Oh, you're muted. I'm gonna, I think you need to unmute your microphone. Yes.
Oh, yeah.
Hi.
All right. Sorry about that. I had to go to the bathroom. And
no worries.
Yeah. I mean, it's like, I don't know. It's like people that don't do drugs, you know what I mean? You know, have this concept of, I mean, oh, it's evil, you know what I mean? Whatever. You know what I mean? And they just, you know what I mean? They don't care what happens to the people that do drugs. You know what I mean? And as far as, you know what I mean, controlling what we put in our body, you know what I mean? We don't really have the control of that either, because it's the pandemic that's going on right now. You know what I mean? They want us to take this, the what is it? The shot that gets rid of all of it. You know what I mean? And it's killing more people than, you know what I mean, it's helping. And as far as, I don't really know anybody, you know, personally that had the virus. You know what I mean? One of my partners went there. They said he had it. We went in there healthy and died when he went in there. You know what I mean? You know what I mean? Yeah, it's crazy. And you know what I mean? He was a diabetic. I'm a diabetic. You know what I mean? And I certainly don't want to go to the hospital for anything. You know what I mean? I mean, my feet are swollen, been swollen for 6 months. I'm not going in there. You know what I mean? You know what I mean? I'm one of those people that have the complications. Oh yeah, well, we can get this one. You know what I mean? Maybe it's paranoia, maybe not, who knows? But I mean,
I know, I totally know what you mean. And I think that you bring a really important point, which is that we have a history in this country of harming people, systems harming people, and I don't trust those systems. And I know people in my community don't trust the systems. I'm from Puerto Rico, I'm Puerto Rican, and I've been talking to other people about hesitancy around the vaccine. And a lot of the hesitancy comes from the fact that our communities, you know, in general, have been used to experiment with, right? And we don't trust. And if we're not treated well in certain spaces, we are not going to want to go back, right? And so I really appreciate you bringing that up and naming that if a space doesn't make us feel safe and welcome, then it's really hard for us to go in and trust that will be different, right? That experience will be different. I really appreciate you sharing that, because I think it's a really important point, particularly in this pandemic that we're living in, right? With this COVID-19, which is another extra layer of complications, right? That comes into play. We are at time. I just want to say thank you so much to you, Tommy, to you, Angie, and to Samuel for being here and for sharing your expertise and your knowledge, but also your passion, and for teaching us and sharing what you know with us. I certainly feel so much more energized, and I know that I will take my lessons learned today moving forward. and I will hopefully be able to implement them as I move through my life and my work. So I really want to thank you all very, very much for being here and for your time.